Diabetes mellitus. Diabetes mellitus refers to a group of diseases that affect how your body uses blood sugar, means glucose. Glucose is vital to your health because it is an important source of energy for the cells that make up your muscles and tissues. It is also your brain's main source of fuel. How does this happen? The process of digestion includes breaking down the food you eat. When you eat carbohydrates, for example, bread, rice, sugary drinks, your body breaks this down into sugar, means glucose. When glucose is in your bloodstream, it needs a help, means a key to get inside your body's cells where it breaks to provide energy. This help or key for the glucose is insulin. Insulin is a hormone made by your pancreas, an organ located behind your stomach. Your pancreas releases insulin into your blood. Insulin acts as a key that unlocks the cell door, which allows glucose to enter your body's cells. Glucose provides energy to organs for proper functioning. Insulin also helps synthesizing fats within your body and prevent their breakdown. When there is no insulin, all fats start breaking in your body, and that is why weight loss is observed in diabetic patients. What are the different types of diabetes? If you have diabetes, it can be a type 1 diabetes or a type 2 diabetes. Type 1 diabetes is an autoimmune disease, means your body's own antibodies attack the insulin producing cells in pancreas, which are then destroyed. Up to 10% of people who have diabetes have type 1 diabetes. It is usually diagnosed in children and young adults but can develop at any age. People with type 1 diabetes need to take insulin every day. This is why it is also called as insulin-dependent diabetes. Type 2 diabetes. Up to 95% of people with diabetes have type 2. It usually occurs in middle-aged and older people. Risk factors for type 1 diabetes include having a parent or sibling of type 1 diabetes, injury to the pancreas such as by infection, tumor, surgery or accident, presence of autoantibodies, means the antibodies that mistakenly attack your own body's tissues or organs. Risk factors for the pre-diabetes and type 2 diabetes include family history, being overweight, having high blood pressure, high fats level, being physically inactive, being age 45 or older, having a history of heart disease or stroke, or being a smoker. What are the symptoms of diabetes? The symptoms of diabetes include increased thirst, weak and tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, unplanned weight loss, frequent urination, frequent unexplained infections, and dry mouth. What are the complications of diabetes? If your blood glucose level remains high over a long period of time, your body's tissues and organs can be seriously damaged. Some complications can be life-threatening over time. Some of these include cardiovascular issues, nerve damage that cause numbing and tingling sensations, kidney damage that can lead to kidney failure, eye damage that can lead to blindness, foot damage including nerve damage, poor blood flow and poor healing of cuts and sores, skin infections, hearing loss, depression, dementia, and dental problems. What should my blood glucose level be? In general, most people try to keep their blood glucose level at these targets. Before a meal, between 80 and 130 mg per deciliter. After 2 hours after the start of a meal, less than 180 mg per deciliter. To best manage diabetes, you will need to take steps to keep your risk factors under control and within normal range, including keep your blood glucose levels as near to normal as possible by following a diet plan. Take vegetables, whole grains, beans, fruits, healthy fats, and low sugar diet. Maintain your blood cholesterol level at a normal range and avoid saturated fats such as red meat, butter, ghee, biscuits, cakes, sweets, which increase the level of cholesterol in your body. Healthier fats are present in olive oil, unsalted nuts, and sunflower oil. Your blood pressure should not be over 140 by 90 mm of mercury, so avoid taking salty food. Exercise regularly. Try to exercise at least 30 minutes most days of the week. Walk, swim, or find some other activity you enjoy. Thank you for watching. If you liked the video, give it a big thumbs up and subscribe to Aimer's YouTube channel.